Hello, I'm Matt Schwartz, Chair of the Worksite Wellness Council of Louisville. I'm here with Jen DeLeeuw, who's with the Clinical Optimization Team with Humana, right?
That's right.
And we just finished a great program talking about clinical programs and engagement with members. And it was about Humana's programs, but really it applies to any, because all carriers and most third-party administrators have these types of programs. So give me the basics. What do you do?
Yeah, absolutely. So we really have a clinical program for every member in any situation that they're in. So whether it's closing a gap in care, sending a reminder that you need a health screening, or if you have a chronic condition like diabetes, we have programs that can help you work with your provider to take better care of yourself.
So, and you talked about kind of different ways that you engage. So, one is you have information, obviously people have claims data, et cetera, but how else do you know when somebody should potentially engage with you all?
Absolutely. We have a lot of information about our members. So if you're involved with a wellness program, you've probably taken a health assessment. We get information from that. You're also welcome to self-refer to our program. So if you get a new diagnosis, you find out you have diabetes and you have questions about it, you're able to refer into our programs, and a nurse will reach out to you. We match the type of communication to what you want. So if you prefer to do text, we can do text. If you want to talk to a nurse every month, we can do that as well.
And then you have those prototypical pyramids, right? Talking about you got 50% of the population spends nothing.
2%.
Less
than 2%.
And then as you move up the scale, just walk me through that concept.
Sure. So, yeah, the majority of people are responsible for a very small percentage of total healthcare costs, and we want to keep those people healthy. So we have programs to help them do that. Things like wellness programs where you can actually earn points to redeem for things like Amazon gift cards. And then as you move up the continuum, people who are dealing with a pregnancy, for example, they might be more expensive for a limited period of time. People, everyone has medical events, so matching an intervention with those people as well, making sure they're getting the right level of care when they do have to go to the doctor or hospital. And then again, people who are dealing with chronic conditions, just making sure that they're managing their condition on a day-to-day basis, and that they know how to work with their provider to get the best health outcomes for themselves.
And then obviously on up to transplants and premature babies, etc.
Super complicated and super expensive situations, and we have very hands-on programs to help those people again get the best outcomes.
So Jen, you also gave some examples, like just specific things, like where people, they're anecdotal, but now they're more than anecdotal, because now this stuff's been going on for decades. So there were some examples of things that happened that that seemed pretty compelling, where people may have just engaged in some fashion, and then all of a sudden it helped them down a path.
Right. A lot of it's just having an expert set of eyes and an expert person who's working with you on an ongoing basis. So, you might get enrolled into a clinical program because you're in the hospital for one event, a knee replacement, for example. After you get discharged, you might continue working with one of our chronic condition management nurses, and they'll see something like, oh, you haven't had your cancer screening that you should have. They'll help you close that gap in care and get your cancer screening, and we've actually seen situations where members have done that, and they've come back and caught cancer early, and it's literally saved their lives.
So we kind of ended the conversation. There was a lot of discussion around the table about how to help engage. So I'm an employer. These programs are built into my program, or as a self-funded, and fully insured, they're built in, self-funded, I can access them.
Mm-hmm.
What are some ideas of how to engage? Part of what we talked about there, but just what you all have experienced.
Sure. A big thing is just making your employees aware of the programs, and letting them know that you as their employer support their participation in the programs. These programs aren't there to substitute the relationship between the patient and provider. It's there to make sure that the most is being made of that relationship. So I think just delivering the message that these programs are really beneficial, and that they are there, and that you have a support system if you need it, and it's there to reach out to.
And to close, I mean, we had an example, you know, somebody said, well, you know, takes you 2 hours or a half a day to go see a doctor, and you get like 6 or 8 minutes with them.
Yeah,
so you want to be prepared.
That's right. Your time with your actual doctor is usually really limited. And then on the other side of the equation, we're also helping make sure that the doctor has a fuller view of your health as well, so that both sides are more prepared to have that conversation and make the most out of those limited minutes together.
So my takeaway from this morning, I mean, one, it certainly impacts cost, but the main thing that I walked away with is that really it's there to help the member. I mean, it's meeting them where they are and helping them have a better, you know, outcome, so
Absolutely.
to speak. It's not really all about cost, but that's what happens.
Right.
Anyway, so we're here every Thursday.